All right.
Also have a big focus on data collection and evaluation. And the big reason for that is because we want to make sure that when we're supporting clients on their goals, that we make sure they're receiving effective evidence-based supports. We want to make sure it's working for them. So it's a great start to know that something in the research is really known to be a great fit for a certain skill, but if it's not working for our learner, we want to notice that right away. And we'll notice that right away by continuously taking data on the efficiency of it and the effectiveness of it for the learner and making adjustments accordingly in real time to help make sure that we are making the most of any time that we have to support people. We think of this as a population-centric kind of design, so you can design your behavioral supports, your teaching plans, your skill development plans around whoever is the population you're supporting. So a really diverse range of both diagnoses, undiagnosed, different ages, different areas of life that they may be in, or different environments that they're in, everything from community to homes to recreation to long-term care and all kinds of things in between. And then, of course, we also want to make sure people are aware that when we do talk about how do we support people with behaviors that challenge, we look at using a positive behavioral support model, meaning that we're trying to say, okay, if there's a behavior that's challenging for this person, something that's creating a barrier in their life, we want to make sure we understand it and we can support them in how to find an alternative way to get their need met, because every behavior is coming from an unmet need. There's a reason behind it. If we can understand that reason, then we can move into designing supports, strategies, and skill development with the individual in ways that feel good for them and that they are part of creating that intervention or that support strategy going forward. So that's kind of our overarching goal of the program. Again, it's meant to be not diagnosis specific, not age specific. It's meant to be something that you can apply for any person who needs support in one manner or another, whether it's skill development or having alternative ways to engage with the environments that they're in.
So the nice thing about this program is that it is very hands-on learning based. So we're going to talk about a few ways that happens in the classroom a little bit later. But we do have small class sizes in terms of how many students are in the classroom learning, and the practicum happens right when you start the program. You start doing your practicum at the same time that you're taking your courses, so that you have real world exposure and can see how what you're learning in class applies to actual people that you want to help and support. So you get to acquire job ready skills through that hands-on experience, get personalized learning in really small class settings, a maximum of 20, and then industry exposure, because you have 240 hours worth of practicum over the course of September to May that you will complete in order to practice what you're learning in the classroom.
So as you can see, we have a long list of courses. A good thing to kind of frame this with, so that you know what you're looking at here, is these courses within the Behavioral Interventions program tend to connect very much with each other. So things that you're learning in one course will tie in with things in other courses. And we try to create a situation where you can see those connections between your courses, whether it's, you're in applied behavior analysis class and you're also doing behavioral assessment and data and trying to figure out how do you put all those pieces together. So ABA 1 is what you start out with. So first semester you have ABA 1, Concepts and Principles, Behavioral Assessment, Neurodiversity 1, Ethics and Professional Practice, Data 1, which is Measurement, Data Display, and Interpretation. And as well as that, down there at the bottom of the list, you'll see a Practicum 1 seminar that ties to a Practicum 1 placement that you'll also be at. So students start placements straight out of the gate when they come into NSCC. As soon as we can get you reasonably set up with your first semester placement, you're able to do that. That placement looks like getting to know the communities you might support and just getting to know what support environments are like, different philosophies that different community organizations will take to their approach to support. And practicums are very flexible in terms of where you would like to go. We try our best to tailor them to students' needs and to facilitate you accessing environments that you would like to learn in, that you would like to be more a part of. And that first semester one doesn't have any behavioral science specific objectives attached to it. It's just getting to know your community and the supports that are available, and seeing kind of how things work, getting to know the populations you might support, as well as the other professionals who support them alongside of you. ABA 1 will teach you kind of our core principles and concepts. Behavioral assessment will look at what are the ways that we assess skills and what are the ways that we assess behaviors and things that are happening. How do we understand what our clients' needs are? How do we work with them around that? Neurodiversity 1 is all about understanding that we need to be taking a neurodiverse affirming approach. In order to do that, we have to get to know the people who have the experiences with varying diagnoses. And we have to start from the starting point of what their experience has been and be listening to that. It's great for us to know what a diagnostic criteria is, what things look like in a medical or even a biopsychosocial model, but we have to really include the participants. And that neurodiversity class is all about getting to know the populations based on those first-person voices. Ethics and professional practice is going to tie you to the ethics of our specific science of behavioral science. As we mentioned earlier, this is a graduate certificate program, so we know that students come in with a background in ethics and they come in with some amount of professional practice experience as well in terms of their understanding of professionalism. So we try hard to tie it directly to our specific field and what are some situations that you may come up. How do you understand our ethical code? How does it tie into the policies and procedures of your placements as well as employers that you may work for later? And how do we handle the sticky situations that may come up? Second semester, you go into Applied Behavior Analysis 2, which is taking all those things you learned first semester and applying them to supporting behavior change and supporting skill development. Same thing with positive behavior applications. Same thing, you're translating more of that stuff that you started first semester into a deeper understanding of how do we support people and how do we create individualized plans with them in order to improve their quality of life. Neurodiversity 2 keeps going from Neurodiversity 1, but Neurodiversity 1, we tend to focus on childhood and developmental years, where Neurodiversity 2, second semester, we tend to focus on that transition into adulthood and the adult years all the way to end of life, and how do supports change? How do the needs change? What are the differences? Are there differences? And then you also have supporting safe approach to supporting behavioral crisis. So this is our course that is really tailored around those crisis situations that come up with some of the clients that we support, where they may be experiencing really difficult behaviors that are making it difficult for them to access going out into community or living in the environments that they want to live in. And how do we support them in overcoming that with new skills and meeting the needs that they have? And how do we do it in a safe way and a way that is supportive of them as a human person and is happening according to their values and according to the rights that they have? And how do we teach the people around them as well around what the rights of the individual are and what advocacy can look like to help them to change the environments that people are in? And then you have data 2. This is around single subject research, and this is one that is teaching you how to both understand the research and how to be able to use it in a way that helps support your client. So it's looking at a lot of those more behavior analytics specific research designs that are out there, and how can we translate that into things that effectively allow us to advocate for our clients and to get their needs met. You also see Practicum 2 seminar, again, that attaches to Practicum 2, which is time in industry. And that industry placement second semester, you're beginning to apply all of the techniques and strategies and everything you learned first semester, you're applying it then. And then the third semester, you see Practicum 3 seminar there. That's your final placement. That happens from approximately mid to late April until the end of May. And during that time, you are full-time on a placement site, getting lots of opportunity to continue practicing your skills and get a lot of really good experience. We have nonviolent crisis intervention on there as well. That'll be embedded during your year at some point so that everybody kind of walks away with that basic certification that a lot of employers in Nova Scotia look for.
Just to pop out, we missed data 1.
Oh, sorry.
Okay.
I totally missed data 1. Right. So data 1 gets you started on kind of the basics of what do we mean when we say we have to actually be making sure that we've planned to collect data and make sure that our interventions are set up in a way that we can monitor them and we can adjust them according to exactly what's happening in real time. So looking at the different ways that you would collect data depending on what the skill is that you're teaching, depending on the environment, depending on the resources in the environment, it may look different. And then also looking at, well, now you've got all this data, what do you do with it? you want to be able to interpret it to make good clinical decisions with your client. And on top of that, you want to be able to display that data in a way that will be meaningful to other people to look at. And so that's what happens in that first class. Thanks for catching that, Melissa.
So to talk a little bit about our teaching approach or what to expect when you come into the program. So from a teaching perspective, we do have content and theory to cover that's related to particular topics each week. And when we're covering that content and theory, we're having lots of interactive in-class discussions where we're asking you to participate, share your thoughts, share your opinions, your experiences, bring in practical examples, or just ask questions about, how you're feeling about the information or what you're learning about it. So it's interactive in that sense. And also we create interactive in-class activities. So different ways that you can practice using the content that we're covering and just check in to make sure that you're learning the content as you go. And we do this in both in group work kind of scenarios and also independent work. So you'll have an opportunity to both work with your peers and try things on your own to make sure that you can do it in both situations. And then we also layer in opportunities to role play, to practice the skills that you're learning about. So we're not just going to tell you what something is, like prompting, for example. We're going to show you and we're going to practice it and give you feedback on how you're implementing that so that you're feeling confident that you're learning the skills and that you'll be able to try it at your practicum and use it when you go out into the field afterwards in an effective way. So that's all part of the teaching and learning aspect. And then when it comes to evaluations, to give you an idea of what that looks like, we do have skills demonstrations. So the things that we've been practicing in role play and that you've been getting feedback on, you'll have a chance to demonstrate that and get feedback and a grade on how you're able to implement that skill. So we really focus on that hands-on piece and being able to demonstrate what it is that you're learning about. And like I mentioned, just like we're doing group and independent work to learn, we can also do that in terms of assignments. And then there are written components in terms of being able to write teaching plans, individualized support plans, being able to summarize behavioral research, and pass that information along to your team members so that you can all keep up to date with what's going to be most helpful for those that you're supporting.
It's great. I think I would add to that just some other examples of ways that we both accomplish the teaching and the evaluation are activities like case studies and engaging in breaking down situations. And sometimes they're case studies that Melissa and I have brought forward from our own experience or experience with colleagues. And other times they are breaking down cases that students are bringing forward or situations that they've seen. I'm trying really hard to make sure that you have the opportunity to connect it with real world situations as much as possible. Likewise, those written assignments and those group and individual assignments that you do, we have those set up in such a way that they're related to things that you would directly be doing in industry. So there are a few papers for sure, because you have to be able to understand research and you have to be able to explain that research well in order to use it to advocate for your clients. But other things are really directly the exact work you'll be doing, writing support plans, writing teaching plans, coming up with ways of how am I going to train the people around this person to provide supports that are meaningful to them and to provide them in a way that feels good for them. And so making it really be about any assignment that you're turning in, we can tell you directly how it connects to the work that you would be doing out in the field.
And we really like to take a scaffolding approach, and that we don't jump in on day one and say, hey, you have to role play for us, right? We get to know each other first and get comfortable, and we build up to being able to participate in those activities. So we try to encourage that kind of safe learning environment, that you're excited to try things and learn from each other as well.
So in terms of your practicum, some things to keep in mind is that depending on where your practicum placement is, there are certain requirements that you'll need to meet. One thing that we can tell you is that when you're going out into industry and field placements, because we are supporting vulnerable populations in a huge variety of ways, a current criminal record check, vulnerable sector check, are always necessary. We have not had any placements that are not going to require that. So it's a good idea to get those things in motion in August coming into the program, so that it is, you know, up to date and that it's current, because you don't want it too far out or people won't accept it, but also sometimes they can take a little bit of time to come through. If you think there's any chance that when you're on practicums you may want to work with minors, then you need to make sure that you also complete a child abuse registry check as well, because any agency that involves working with children will require that as well. Other things that we make sure that we have throughout the program, standard first aid and with CPR level C, that's something that's offered a few times a year through community organizations at the various campuses, and it's something that you may not need for a particular placement, but it is something that we offer to make sure that you have that completed, because it's a skill that or a benefit that if you have it when you're applying for a job, it's something that's often listed as something that people want you to come with. If you have any inkling that you may want to take a placement that involves the health system in any way, shape, or form, or community services, then you'll also need to fill out the standard immunization form, and that can be found in any of the materials that are sent from student services. But basically it means your vaccines have to be up to date with the basic vaccines that are listed here. There's more details on those forms, but they are ones that do sometimes take a little bit of time for people to access. So that's one that think ahead of, do I think I may want to try something that's in health or community services? Because if you do, you'll want to get in touch with your family doctor or public health in order to get that stuff taken care of.
All right, well, thank you both so much for all that information. I'm just gonna go over a few things in terms of housing and tuition and things, and then I'll bring you back and we can talk, answer some questions. Alrighty. I'd like to talk a little bit about housing. So the campus housing, there are some at Annapolis Valley campus. There's a 40-bed facility here. March 1st, applications open to apply for housing, so you can just do that at nscc.ca.
Jenna, I think we might have lost your volume. I'm not able to hear you anymore.
Can you hear me now?
Yes, we can hear you now.
I'm gonna go back. Oh, 1 second, sorry. Thank you for letting me know. Oh. No, 1 second. Sorry, folks. We should be back in a second. Here we are. Okay. So I just talked a little bit about the housing options that both of the campuses that offer behavioral interventions do have. Here it shows our facility at Annapolis Valley campus. So there's 40 beds here, and you can apply starting March 1st. So applications are currently open to apply for campus housing. Also at the Strait Area campus, there's housing. Here is our facility. There's 51 beds at this campus. And again, you can apply now because applications are already open. So I talked just a second ago, but I was muted. This is actually wrong. So the actual number for this program, as it is only 1 year and it is a graduate certificate, is actually $5,540 for domestic students. For international students, this is correct. It is $11,690 for the year. If you want more detailed information about that, you can go to nscc.ca/program fees. Here is a more detailed program cost, and I like to frame this as being a budgeting tool for students. All the costs you see here doesn't mean that you will have to pay those. For instance, sometimes you can get textbooks secondhand, or you may already own a laptop, things like that. So this is a really good tool for budgeting. So if you want to know how much money you do need for school, you can use this. And you can also find this on our website, nscc.ca/program fees. All right, we also have scholarships, bursaries, and awards. NSCC offers over $3 million in scholarships, bursaries, and awards every year. The criteria that we look at is financial need, career interests, leadership, volunteer experience, and academic standing. You can look on our website what the awards specifically are. And once you're a student, you can sign into our portal, fill out an application, and from there, it will match you with what awards that you qualify for. For more information on that, you can go to nscc.ca/student award. Application deadlines. So for domestic students, there actually are no deadline, although I do recommend applying as soon as possible if you want to be accepted into a program. There is a $40 application fee. For international students, all applications must be in by April 1st, and there is a $100 application fee. For international students, if you already have a study permit, send it to documents@nscc.ca right away. All right, so now is the question portion. Zorka and Melissa, if you'd like to come back. Okay, so we have a few questions.
Before we begin with those questions, could we just go over with the students? We missed talking with them about the possible career options after the program. So we should probably give them a quick little intro to that, since I know that's a really common question that we get when we're talking to prospective students.
I feel like I may have missed that slide here, so let's bring it up.
It would have been right after practicum, practicum considerations. There it is.
I feel like I did a few times. Skip this slide, sorry about that. Okay, here we go.
Okay, so our students tend to go out into many different areas in industry. Melissa, please feel free to jump in wherever you please. They work with people across the lifespan, all the way from very young kids in programs like Quick Start at Autism Nova Scotia, so we're talking like 18 months old, all the way up to graduates who have created programming in long-term care facilities to support seniors who are living with dementia or other challenges, or just the general challenges that come with end of life and being in a facility with lots of other people and how that may impact. And everything in between. So we see people working as inclusion specialists in recreation settings and daycare settings. People work for our health center teams in a variety of positions, including with early intensive behavioral intervention and increasingly with the preschool, the provincial preschool autism support program. We also see people as developmental interventionists with NSCC DIS. They work in the regional centers for education, particularly in our Schools Plus programs. And they support people in other organizations across the province, whether it's group homes or vocational workshops, small option homes, residential facilities, or grassroots community organizations that have created supports to help people with diverse needs. We've also seen people go and find careers working with at-risk youth, places like Phoenix House and Lang House, And as well, just kind of spreading out and going into really varied areas. We've had some people who have provided supports within the correctional facilities. We have people who have worked in fly-in communities in Canada's north to provide supports there. And I'm sure I'm forgetting some as well. So tends to tailor very much to what people's passions are and what their interest is and what populations they like to support.
Nothing to add.
Okay.
Comprehensive.
Okay, thank you for that, and sorry for skipping over that important piece. So we do have a few questions here. Our first question is, would my Bachelor of Education in Psychology be an acceptable entry criteria?
Absolutely.
I'm just gonna go to end. Okay, perfect. Can you become a BCBA once you complete this program?
Great question. At this time, we are not a verified course sequence. It is something that we are constantly trying to move forwards to, and our curriculum is designed based on the current task list for the Behavioral Analytics Certification Board. It's important to note as well, though, the minimum requirement to be a BCBA is a master's degree, along with the coursework that you would learn in programs like this that have the BCS certification. It's possible that we can have that done. It's possible you can challenge for that, but we can't make any promises around that. All we can tell you is that we have tied our outcomes and our classes around what are the requirements of the board for BC ABA certification. So Board Certified Assistant Behavior Analyst, which requires an undergraduate degree as well as specialized coursework in behavior analysis. I believe it's 1,000 practicum hours, supervised practicum hours, and then passing an exam in order to complete that BC ABA process. And that's certainly something that we discuss with students every year throughout the year. The question comes up a lot on how people can acquire those designations as they go.
Do students need to find their own practicum?
That's another really good question. If you have a place in mind that you're interested in, you can certainly check with Zork and I and see if we have connections, and we'll help facilitate that for you. If you have no idea and you're new to the area, we have a number of connections already established from students that we've been supporting over the years. So we can try to connect you to a location and a practicum that's of interest to you. Or we can explore something brand new and explain the course outcomes and what you're learning about in class and have a conversation with the team there and see if that would be a good fit. So it's really pretty wide open in terms of where you want to do your practicum and with which population or organization or setting. Zork and I help facilitate that and encourage you to have open conversations about what you're looking for, so to help prepare you also for looking for jobs after you graduate. So it's really a collaborative process, and based on where you would like to be and what you would like to do.
Thank you. Is there currently an oversight body, example, college, union, government department, that would oversee graduates of this program?
Wonderful question. There is not currently. The behavioral sciences field in Nova Scotia is unfortunately entirely unregulated. So people are generally supervised and supported via whoever it would be their supervisor within any organization that they work within. However, we do have an Atlantic Provinces Association for Behavior Analysis, where many people who are in the field in all 4 Atlantic provinces come together. There's a great community there of people who support each other as well as supporting students. This year, we had some students who attended the AP-ABA annual general meeting and had a great experience meeting other behavior analytic professionals in the various provinces and making connections towards learning experiences as well as jobs. So there is not an oversight body like a College of Physicians or the College of Psychologists, but there is a professional body that provides support and oversight to people. If you were to seek your certification, even then, there is no regulatory body within Nova Scotia, but if you had a certification, as Melissa said, I do with BCBA or BCABA, then you'd be overseen by the Behavior Analytics Certification Board. and they have an ethical code of conduct that must be followed, as well as continuing education standards that have to be met.
And we are hoping it will continue to progress in Nova Scotia. Ontario is making headway in terms of, this July they're going to be regulating behavior analysts under the College of Psychologists, and British Columbia is making some headway as well. So we do hope that within time that it will become a regulated profession, and we can make sure that we're providing safe, effective services for families and individuals, and they know what quality they're going to be receiving.
Thank you. Another question here. We have a few more, lots of questions actually. Okay, are there any accommodations for students who have learning disabilities, i.e. note takers, extra time for tests, etc.?
Yep, absolutely. So the college provides services to individuals who need additional supports in order to be successful in their learning. And Melissa and I do the same thing within our own classroom. NSCC very much follows a policy around a universal design for learning, making it that your classes should be accessible both in terms of the modes that information is presented to you and the ways that you can demonstrate your learning. So for a lot of people, that in and of itself comes as once they get into it, kind of a surprise of like there are multiple ways you can do any given assignment to demonstrate your knowledge of that subject. But we also can provide specific supports to individual services to individual students if they require note taking. Additional time on tests doesn't come up because neither Melissa or I actually do tests in the program at all. So none of that. So yeah, we can absolutely do that, and we try to tailor things as much as possible to an individual learner's needs.
How many hours per day are required for placement?
It will vary depending on which practicum you're in, but your first practicum that you do from September to December, you do a total of 30 hours over that time. So if you start early, you'll be done early. You can go, right, we usually 1 day a week you're going, so you can do a full day and be done your hours in a couple of visits, or you can do half days and spread those out. It's about reaching the outcomes more so than the hours. You want to make sure that you're getting a chance to learn about the setting that you're in and how BI might be helpful in that setting, more so than like calculating every 15 minutes that you're there. So 30 hours is the guideline for you to follow, and we check in and talk in our practicum about what you're learning, what you're seeing, and connect it to your learning. So we're looking at a few days in your first practicum. Second practicum that goes from January to April increases to 60 hours, and you still go 1 day a week. So at that point, students usually go for a full day, that 1 day a week, in order to get their hours and reach their outcomes, because you're starting to apply what you're learning, so it requires more time to be there. And then your final practicum, you go 5 days a week, full days, in order to get your 150 hours in that 5-week period. Some people do, sorry, yeah, go ahead.
No, go ahead.
I was going to say, some students go on different days, like if we don't have class on a particular afternoon and there's a really good learning opportunity at your practicum, or evenings or weekends based on the site that you choose, you kind of make your hours work in whatever works for the organization and the outcomes that you're practicing. So it is very flexible in terms of when you go and how you collect those hours. And we just really talk in class about what you should be practicing while you're there in order to get feedback and learn the particular skills you're trying to practice.
Thank you. How long are the daily classes, day start and end time?
Your face-to-face classes happen 2 days a week, and they're back-to-back days. In order to facilitate that if people have to travel, then they're traveling and they can potentially stay overnight if they need to, because we do have a fair number of students who commute to both campuses when they're coming in. So on those face-to-face days, classes begin at 8:30 in the morning. They can run as late as 3:30. Sometimes we have courses set up slightly differently where they may end a little bit earlier, 2:30 in the afternoon. Not generally much earlier than that. So I would say anticipate those face-to-face days to be at least 8:30 to 2:30, if not 8:30 to 3:30. Your online courses also start at 8:30 in the morning, but they tend to be they tend to be like slightly less on the hours. Like I think right now we have our face-to-face days on, or our online days rather, we have one day that is 8:30 till 2:30, I think, and one that is 8:30 to 12:30.
Thank you. How do the skills learned in this program compare to other professions who also deal with behavior, like psychology, psychiatry, counseling, therapy, or simply how is the scope of practice different from others?
You want to take that one, Melissa? You want me to take it?
Yeah, I think you're better suited for that one.
Sure. So I'm happy to talk about that. Like I said earlier, my background is clinical psychology, so I have a great love for that particular field and have spent some time in the counseling therapy world as well. Some of the things that set behavior analysis apart from that and the approach that we're taking here is really making sure that you're providing direct support in skill development, whether it's a skill in order to handle a challenge that happens in your environment and how your emotional reaction is to that, or it's a skill to be able to learn to approach somebody in your work environment to talk about a difficult conversation, or whether it's a skill to teach communication to someone. So where you might have, say, psychology, counseling, speech language pathologists working on communication, you would find us working on communication as well. And we would tell you, like, it's great, you should have those other people involved as well. An SLP involved in communication is always going to be a good thing to have. That is not my specialty, but my specialty is applying how do we help the individual to respond to the cues in the environments, to be able to use their communication skills, how to generalize the skills that maybe they've learned in speech pathology to their needs in the individual moment. So we focus on how do you actually make sure that your client is using that skill or that strategy that they have for, say, emotional management in the specific environments that they're going into, and then how do they generalize that in ways that help them to increase I often talk to my students about like increasing the scope of their life. Oftentimes when we're supporting diverse learners, particularly if they have challenging behaviors, the scope of their life has started to shrink down because they no longer are able to access environments based on some challenges they're having with behavior. And what we want to see is people's lives open up to be able to go and do anything that they would want to do. So we have a big focus on that approach of gain the skill and apply it in your environment and work on it until it's mastered and able to be used by the individual in flexible ways that meet their needs. That counters a little bit with my clinical psychology background, where we might talk about a skill, we might talk about your feelings around it, we might work on like some strategies for you to manage that, but it happens in the context of an individual session and doesn't tend to happen in the context of like going out into your environment and using it alongside the professional who's supporting you. Where in behavior analysis, we tend to work natural environment and trying to make sure that people get the hands-on approach to the skills that they need. We take very much a multidisciplinary or interdisciplinary team approach. So we talk a lot throughout the year about the other professions that also work in these varying populations and these varying support needs, and how we work together with them to complement each other. Because when I come together with some of the teams that I've worked on, you have my background, but you might also have a psychiatrist, a psychologist, a speech language pathologist, an occupational therapist, an educator. And on top of that, you have the individual themselves and the people who know and love them and care about them and have supported them. And you bring all those people and their expertise together to build something that is unique to that client and to what their individual needs are. We want to take that person-directed approach always, where the individual is included in the setting of goals and in the decisions around how do we accomplish those goals. And that happens to a certain extent in other professionals as well. But what we focus on is that application directly being used to make a difference in your day-to-day life, and being there to support you in actually using it in your day-to-day life.
Okay, thank you. Currently, that is all the questions. Does anyone else have any questions they'd like to ask before we leave? Oh, one more question here. Okay. I've already applied to the program, but there wasn't a place on the application to explain relevant experience. Is this something I can add to my application to boost my chances of getting accepted?
I don't know if there's a way to add to your application. That would be something to talk to recruitment about, I would think. But I would tell you that at NSCC, basically, if you meet the base program requirements, that is what they're looking for. So are you coming in with either an undergraduate degree or a 2-year diploma in a related field? We have had some people who have come in with an undergraduate degree or a 2-year diploma that's not in one of those listed fields, but is applicable to what we do. And in those cases, usually what happens is the registrar's office will contact the faculty or the academic chair and say, you know, hey, this is the field that they're coming from. Do you think that that would work? And we may have follow-up questions, or we may say, yeah, we've seen that before. That should work just fine. So I would say if you have a question that's specific to something like that that you think is necessary, email the registrar's office.
Yeah, no, I think you get it, Zorka. I don't think you have to add anything extra to your application. So just the minimum requirements, and then if there's not a wait list, you will be accepted into the program. So, and currently I believe there is no wait list for either location, so you should be able to get in if you have the minimum requirements. Okay, we have a few more questions here. Do you know of any students who went into a Bachelor of Education after obtaining this certificate?
Yep. Definitely. Do you want us to share more about that? We can, I'm sure. I have students who did placements within their BI program where they worked in schools and they really saw the needs and decided that they wanted to go back and get their Bachelor's of Education. The students that I've come across who've done that have gone on to do like the accelerated Bachelor of Education programs that are offered at St. FX and Acadia, I believe. I'm not sure if the Mount has one yet or not, and have gone on to work in the school system that way.
And I think it's a nice fit either way. If you're coming in with a Bachelor of Education, it's really going to add to your understanding and your current practice. And then if that's something that you really find a love for working in with school age populations and you want to get certain opportunities that are available in the regional education centers, then that might be something that you want to consider.
All right. Well, I think we got all the questions for now. If you have any other questions, please email recruitment@nscc.ca. We'd be happy to answer those questions. And if they're very specific to the program, I can connect you with one of our faculty who are with us today, because they are the pros of the program and they can answer your questions better than I can. So thank you so much, everyone, for spending your Tuesday evening with us. And thank you, Zorka and Melissa, for being here. Super helpful. And yeah, thank you.
Thanks for coming, everyone.
Thank you.
Alrighty, I'm going to end the webinar now. So have a nice day. Have a nice evening.